How do you know that you're depressed? That's what I'm going to talk about in this video. So stay tuned throughout the video to know everything about depression. I'm Dr. Sudha and I talk about mental health. Tap on subscribe button to know everything about mental health. We don't have any blood test to diagnose depression, but we do have some of the cluster of symptoms to tell whether you are diagnosed with depression or not. If you have any doubt that you have depression or any one of your loved ones is suffering from depression, you must look for these cluster of symptoms. So let me tell you what are these symptoms. They are persistent and pervasive low mood, or persistent or pervasive throughout 15 days or more than 15 days if you are suffering from sadness and low mood, or anhedonia, where we call that person is disinterested to do anything which was earlier pleasurable to them, extreme tiredness, fatigue, extreme guilt, pessimistic views about future, that is negative thoughts about future and apprehension, unworthiness, death wishes, suicidal ideations, disturbed sleep and appetite, loss of concentration, unable to focus on any particular work, through which they tell us that they have some of the memory problems. So these are few of the symptoms, that is 9 symptoms, out of which at least you have 5 symptoms for about continuously more than 15 days, then we can tell that you have a depressed mood or you have mild, moderate or severe depression. Sometimes patients also tell us that even if there are no stressors or not any traumatic events have happened, but still they feel not to get up from the bed, extreme crying spells. They don't know what is the reason behind the crying spells, but they feel very low. If they have mild sort of depression, it might pass through time, or as the time passes the depressive symptoms can come down. But if they are suffering from severe depression or moderate depression, they might need a professional help, a psychiatrist or a psychologist. Also they need treatment to come out of it. So when I talk about treatment, it might come up in my upcoming videos. So please subscribe the channel to know more and more about mental health. Thank you and namaste.